Welcome to our fifth Life After Lockdown event. This is a series at UTS where we try to visualise what life after lockdown will look like. Today, in law at the time of COVID-19, we'll explore the current legal landscape in Australia. What's changed because of the virus, and what's working, what's not? What are the implications of some of the changes that we've seen? And what might that indicate for the future? What changes might be set to stay? And will that necessarily be a good thing? I'm the Dean of Law at the Faculty of UTS, Faculty of Law at UTS, and my name is Leslie Hitchens. And I'm very pleased to be able to welcome our panel, all of whom are members of the Faculty of Law. Professor Thalia Anthony, Dr. Elyse Methven, and Dr. David Carter. So today we'll be discussing new laws and regulations introduced during this crisis. We'll discuss police powers and also the powers that health officials actually have. And we'll discuss your rights in this new world. Before we begin, I would like to acknowledge the Gadigal people of the Eora Nation, upon whose ancestral lands our city campus now stands. I'd also like to pay respect to the elders, both past and present, acknowledging them as the traditional custodians of knowledge for this land. Now, you can see our panel on the screen, and you can send through your questions using the Q&A section at the bottom of the screen. What we'll do is at the end of the webinar, after our panelists have spoken, there will be an opportunity for us to the panelists to respond to the questions that you've posed using that Q&A button. Now, and I think probably a few have come through already. Finally, what I'd like to say is please bear with us if we have any technical problems, but we'll certainly do our best to keep things running smoothly, and I'm sure it will be fine. So to begin, I think it might be useful if we have a bit of a summary of the legal changes and restrictions which have been introduced. And I'm going to turn to Elyse Methven, Dr. Methven, first of all, and ask you, Elyse, can you give us some idea, some overview of what we've seen during this period?
So there have been quite a few different orders, as we would all know, and it's been quite hard for many people to keep up with the changing orders, given the pace that they've been made, the different exemptions that have come into force. But generally, we would probably recall in the Australian context that Prime Minister Scott Morrison announced on the 29th of March a range of restrictions on movement and whether people could leave their premises or not. And basically the rule was you could not leave your premises unless there was a reasonable excuse. However, after he made that announcement, it was up to the states and territories to enforce those laws. And that's why you had quite a different approach depending on which state you lived in or territory you lived in. And also that also depended on the different, I guess, state of where the coronavirus was at in those places, with high numbers of infections in places like New South Wales, Queensland, and Victoria, as opposed to some of the other states and territories like the Northern Territory. So to use New South Wales as an example, New South Wales the following evening at about midnight enacted this new public health order. And the thing about public health orders is that they are executive orders. They're made by the Minister for Health, and there's no real debate or anything that goes on beforehand. They were clearly drafted quite quickly, and there wasn't a lot of time to communicate the substance of those orders to the public. But we will recall that they basically said you could not leave your home unless you had a reasonable excuse. For example, it could have been to care for others, and there were a range of excuses there. That law came into force at approximately on the 30th of March. However, it has been superseded by a new order which commenced on the 15th of May, and it's that new order that is in force now. There are a bunch of other orders as well, but this one basically restricts gatherings in New South Wales to up to 10 people in a public place with some exemptions, and also for private premises, people can have up to 5 visitors to their premises. There are also a number of other offences which I'm sure we can talk about as well, such as the spitting and coughing order, which is quite a new offence that restricts people spitting or coughing on a public health official or a public official. That has been expanded as well to retail workers and other workers. And the order says that it's an offence to intentionally spit or cough on a public official in a way that is reasonably likely to cause fear about the spread of COVID-19. So it's quite an interesting offence.
Thanks, Elyse. And I mean, you mentioned that states would have different responses in terms of these restrictions. And I mean, one of the things that may have been curious was seeing the Prime Minister announce rules, but then something happening quite differently elsewhere. And do you think as a community, we really understood or understand those different levels of government and how they work together? It's been quite an unusual situation in a sense, with the Prime Minister announcing various rules, but then them playing out differently across each state and at local levels as well.
Yes, definitely. So I think there was confusion when Scott Morrison made those announcements about, okay, is that law now? And where's the source of authority? Does it reside in the Prime Minister, or where do we go? And so I think that wasn't really well communicated to the Australian public at the start, exactly where they need to go to find these public health orders. I mean, even I spent a bit of time trying to find the exact orders as a lawyer, so I can understand some members of the public would be quite confused about, you know, do you go to the Commonwealth legislation? Do you go to the state legislation? And in fact, it is the states and territories that have the power to make a lot of these laws under emergency provisions in their respective public health acts or similar. So a lot of this is state or territory based, and it means that Scott Morrison, the Prime Minister, can make these announcements, but it is up to the individual states or territories as to what rules they will enforce, and also the penalties attached to those orders. So that's why you have quite a difference in the approach. For example, in Victoria, they're quite expensive penalties, more than $1,000. In Queensland as well, compared to New South Wales, which is capped at $1,000 for the on-the-spot fines when someone breaches those restrictions on gatherings.
So if we were in New Zealand, which in many ways has taken quite a different approach, but would we have some of the same complexities?
No, we wouldn't. And obviously they've been meeting with this National Cabinet to try and have some uniformity of approach, but we can see that that hasn't really played out. And that is the prerogative of the states and territories to do so, because they have to make the laws and they are answerable to their particular voting public. So in New Zealand, you just have the Prime Minister and then also local government. So you don't have that middle level of state or territory government. So it does, I guess, create uniformity in the New Zealand context in comparison to the Australian federal system.
Elyse, I was interested when you mentioned about the new order around coughing and spitting. And of course, as you actually, and I can't remember all the words, but as you read out that new rule, it's about reasonable intention, whether it was reasonable and various other things. So can you tell us just generally as a bit of an example, I mean, So does that mean we can or can't spit, or, you know, if we spit at someone, I'm not suggesting I'm about to do this, but, or any of the audience, but if we, if that happened, is that it? We're gone? We're up for some penalty?
I mean, that's the whole question, because these are offences, they are quite complex, and there's not a lot of interpretive material that accompanies them, because unlike the ordinary creation of criminal offences where they're debated in Parliament, people propose amendments, they're voted on, there's explanatory notes, there may be some brief explanatory notes for these offences, but there's not a lot of accompanying interpretive material. Now, it was already an offence at common law in New South Wales to spit on someone if you intended to spit on someone and contact was made there. That would come under the offence of common assault, in fact, what we call a battery in New South Wales. Whether you cough on someone, that's a different question, might not have come under the offence of common assault. So it would have been good to debate the need for this offence and also the penalty attached to it. But also those terms, like you said, they could cause confusion. So we can see that there's a subjective element there, intentionally spitting at or coughing on a public official. So the spitting or coughing has to be intentional. But then there's an objective element, which is in a way that is reasonably likely to cause fear about the spread of COVID-19. So that suggests that it is the reasonable person that would judge whether it would cause that fear. So we call that an objective standard in criminal law. Now, this might be quite difficult for a police officer to decide on the spot, noting that police can issue $5,000 penalties for this offence. So there's a complex mix of subjective and objective elements. Again, I'm not sure about the amount of training police have had in terms of the legal elements of this offence and how to interpret them.
Thanks, Elyse. And I think that just probably gives us an idea of what seem like simple restrictions during this period can become very complex and involve a lot of often well-established legal texts, tests and so forth. And it would be very interesting to see if any of these were tested at some point. But it does show the complexity as a community, as citizens, what we're dealing with. I mean, I know personally, and I tried at the beginning to, you know, follow the public orders, but I found it very confusing. And you know, some time past, I did have some legal training, but you become quite nervous in that environment about, are you doing the wrong thing? You know, which bit was where am I meant to move, and so forth. And David, that might be a good spot to ask you, point to ask you some questions as well, because I think the police powers question has been really interesting here, and often the way they've used it, you know, a lot of police down at Bondi, but you don't see them so much at Coogee, different things like that. So I just wonder if you could describe some of the police powers that have been given during this period, and you know, the extent to which they might be concerning for us.
I think, Leslie, I mean, for me, it's kind of a busy time because I specialise in criminal law and public health law. So when these two things have come together, it's been fascinating. And I think it's been kind of fascinating for everyone as well, because we don't normally see our police forces out there enforcing public health laws or regulations. You know, as important as sewage systems are to our public health, the police tend not to be interested in that. And in fact, even with things like HIV, the police have traditionally, both at law and policy, taken a kind of respectful distance from that and let public health officials, doctors and individuals concerned take care of themselves. So what we've seen though with COVID is a very rapid, as Elyse said, in relation to the sort of the directions given by the minister, as well as some subsequent orders, some rapid lawmaking, as well as some rapid increase in the powers to enforce these directions and orders made under public health acts across the country. In New South Wales, for example, the Public Health Act and also the Commonwealth equivalent, the Biosecurity Act, now has provisions for police essentially to enforce aspects of those directions or orders that are made, usually by use of warnings, but also issuing on-the-spot fines in New South Wales, for example, $1,000 for most of them, and then $5,000 in some other offences. These are new powers for police. Obviously, police issue all types of on-the-spot fines all the time, but the issuing of fines to enforce public health directions is a very new thing. In addition to that, the appearance, for example, in New South Wales and other states of the Police Commissioner, for example, front and centre in daily briefings with the Premier and Chief Health Officer, is also a sign of the increased involvement of police and policing in these approaches. As I said, police have been largely absent from public health practice in the past, both because some of it is really not kind of something they can much help with. As I said, things like sewerage and those kinds of things are fundamental public health practices, and the police, thankfully for them, I think, don't have a lot to do with that. But even in relation to more contentious issues like onward transmission of disease, for example, police have tended to stay away for lots of good reasons. As you said, it makes people nervous, for example, and what we need in public health is generally not people to be nervous. We need them to be empowered and to be behaving in a kind of communal way. And so that tends to mean that we tend to keep a distance between the criminal law and public health. Instead, you've seen, as you probably indicate, some vision in the news of policing social distancing, driving around in some public parks, questioning people about why they've left the house and the like. And that's been a very new part of our enforcement of public health. But as we can talk about in more detail under some other questions perhaps, there's always been a kind of involvement, but this is a kind of new shift for us anyway.
We'll come back to that, David, but Thalia, I think you wanted to...
Yeah, thanks, Leslie. I just wanted to chime in and say that David's absolutely right in saying these are new and unprecedented powers in Australia, but there's also been problems, and I would say an overuse or a misinterpretation of some of the powers. So, for example, on the night of the 15th of May, when it became lawful for people to meet in groups, the police was still apprehending people who were meeting in groups. So the laws were changing very quickly, and this was a question put to the police minister in New South Wales Parliament, and he simply didn't have an answer or even understand the new laws and their operation. So it kind of indicates how confusing it must be for people, and how they must really not understand how to exercise their rights when they're approached by the police, given that the powers are so vague in instances, but also changing rapidly. And I just wanted to re-emphasize also the point you made, that Leslie, that they're used quite arbitrarily. So we're seeing many more police using these powers in the West compared to the east of Sydney. And this just, I think, amplifies the usual arbitrariness and, I would say, discriminatory nature of policing on the streets and in society. And that can have really long-term consequences after COVID. And I think that's something we really need to keep in check, as those powers continue to exist. And there's no real indication when there'll be a total cessation of these types of powers or laws at the moment.
Sorry, I think that's a really important point, and it's something we can follow up as we go through. And I think it's interesting that when we look at something like the COVID Safe app, there's been a lot of, concern and discussion about the security of that and the longer term implications in terms of data retention and privacy and so forth. But we don't seem to have these discussions around policing. And yet that's been the thing that's been so pervasive during this period for obvious reasons, in the sense of the approach that we took. And I suppose, David, that goes back to your point, and that is really, this unusual situation of the police being involved, where these might be health officials normally. And I mean, I would say, well, after all, it was a crisis, and we don't normally see health officials roaming, through the parks and beaches and things like that. So weren't the police the obvious people to do this? But So, you know, in a sense, what's the risk there that you see, or what's the downside? And you mentioned one thing about the way people might respond. You know, law-abiding people like me get nervous if the police are around. So, you know. Yeah.
Entirely natural. They're meant to be intimidating. They're designed to be intimidating, and you know what? That's exactly how it feels. Look, I mean, I take both Thalia's and your point together, perhaps. I mean, yes, in a sense, it's a practical question, right? We've got a bit of an emergency, and it was a kind of emergency, and still is in some ways. Kind of, you know, what workforce is to hand that are mobile and spread across the state and are ready to assist? Well, naturally, police come to mind. I mean, we have a lot of nurses, but they're otherwise occupied. You know, and we have some public health officers, but they're also very occupied. So I understand why you reach for this, and I understand as a practical measure and in a sense of it being an emergency. But I mean, I think an important part to remember is that what we're talking about here is disease transmission, and we're talking about what we might call health behaviours. So, for example, whilst I know that many doctors would like you know, us all to exercise exactly, you know, 3 or 4 times a week for half an hour and to only eat healthy meals. These kinds of practices, these health behaviours, are not necessarily most effectively sustained through kind of black and white enforcement, or the kinds of enforcement and threat that we use in relation to more standard criminal issues like assault or other things like that. And so in a sense, you know, whether or not you are of being safe, if that's the right way to think about it in relation to your disease transmission behaviours with COVID, is still a health kind of question. Yes, people need to build skills over time, but they're not really conducive to a kind of policing response for lots of reasons. And in fact, if we do that, we know, in fact, it ends up being very ineffective. But also, we need to realise that these are kind of things we need to build as a skill. We need to build it with other people. We need to rely on other people, and we need to kind of keep it, as we do with things like exercise, a kind of negotiation so that it fits into your specific life, your specific community, and your specific risks. I mean, I should say too that part of the kind of devolvement, for want of a better phrase, of public health powers into policing also highlights, at least for me, as someone who's an expert in public health law, just how often public health practice is in fact also a kind of policing function. I mean, we think of public health often in very positive terms, and so we should, about health promotion and the like, but, you know, public health practitioners, doctors, nurses, and public health officials are involved in the kinds of policing functions that we're seeing now all the time. I mean, my recent research on this, which came out a month before COVID, some great timing, showed that across all the states and territories in Australia, public health officials are detaining people, often, in my view, arbitrarily, or at least without sufficient transparency, and very often detaining people who have, say, TB or HIV, but really you're looking at people who are poor, who are homeless, who are Indigenous, and other things like that. And so you kind of start to see that, in fact, there are some connections here, because what we're eventually trying to do, in some ways, is to have people do certain things and not do certain things, usually with their bodies, performing certain acts and not performing certain acts, usually with their bodies, and that we use all types of, the state uses all types of influences to do that, including the use of force and detention and quarantine and the like. And so there is a connection between the two. You know, we think using the health practitioners and the health approach is more effective, probably more human rights respecting, and in fact more fit for purpose, but there is still this underlying kind of connection.
Thanks, David. You mentioned HIV there, and I'm old enough to remember the time when that was viewed as a crisis, and Australia became quite a leader in the approach that was taken to that. So does that give us a model for the way we could have handled this pandemic, or, and perhaps you can describe what may have been different around that?
Look, you know, it's always great to have hindsight, and we actually have it in this case, but we have it with HIV, you know, a genuine crisis of public health and a clinical crisis. It's a disease transmission event. Yes, in some ways it's different to COVID, both in the way it transmits, but we have some key lessons, particularly around policing and enforcement. We know fundamentally that in relation to HIV, criminal law and criminalisation doesn't work. It's not the right answer. Not only this, but, you know, if we start to go down that path and sustain it, what we end up doing when we apply the criminal law hammer is that we start to frame certain people as offenders and certain people as victims, certain groups as stigmatised and certain people as not. And what we need is not that. Instead, what we need is a kind of shared and mutual responsibility for us to together reduce onward transmission for a disease like COVID just as much as HIV. Using criminal law does a range of things, but we know in relation to HIV that it eventually produces stigma and fear, and that reduces our best and most effective efforts at reducing onward transmission, and so is, in a sense, useless. In fact, worse than useless, it probably makes it worse. And that we also know that laws that criminalise HIV exposure and transmission, for example, are usually drafted very broadly and applied very broadly and indiscriminately, and often punish behaviours that are not blameworthy. And because of this, we end up having people not wanting to engage with health services, people not being honest about their status. And if you think about what Thalia was just saying, it sounds awfully familiar in relation to some of the COVID-related laws, that there are broadly drafted, broadly applied, often punishing behaviour that's not blameworthy. I mean, you think of those small stories that you hear and you see in the news about people sitting on a park bench 200 metres away from someone and yet being asked essentially why they're there and to move on. Well, as soon as you know about onward disease transmission with COVID, you know that you represent no risk to yourself or other people if you're catching your breath after a walk for 10 minutes on the park bench. And so when you start to apply these things broadly and too broadly and apply them to behaviour that's not actually blameworthy, people start to disengage and you end up not having an effective response.
Thanks. And Thalia, David mentioned their shared responsibility. Is that what we understand as citizen policing? And is that, you know, what does that mean in fact? And what are some of the ramifications of that?
Yeah, thanks, Leslie. I think we're in the midst of this phase. Like we've come from a phase where the message was very much stay at home. Now the message seems to be get out and spend your money. Let's get the economy going. So it's not quite that clear cut, but we're absolutely in that transition. And in order to manage that, one of the messages that has been given by the New South Wales Health Minister and the Chief Medical Officer has been, you should exercise personal responsibility, but also feel comfortable telling other people to be responsible. So, for example, Brenda Murphy said, if someone gets too close for you, tell them to back off. Tell them to keep 1.5 metres away from you. And so it's really shifting, I think, social interactions. And we don't have that much precedent in Australia. We don't have that psyche like in the US where we do police one another in that type of way. And we know in the US where that manifests, it can be quite aggressive and even violent. And I actually think it's a good thing we don't have that. I would much prefer in this transition that we don't just enter into these confrontational relationships, but we get clearer support to be able to exercise social distancing. For example, we simply don't tell our colleagues to go home if they enter and, you know, if we're working in an abattoir and they seem to be a bit sick. We don't just tell them to go home. We do things like provide sick leave for people in abattoirs. So I think there are real things we can do to support this transition, to make it practical without putting the onus on one another to enforce that.
It's a good point too, in the sense of, as you say, supporting people, because, and I was thinking too, when David was talking before about if you make people fearful and so forth, you know, that also can affect different socioeconomic groups then and have an unequal impact, because you've got, you know, those people may be more anxious about disclosing health issues and so forth because of the ramifications perhaps for work and different things like that, and imposing, in a sense, a controlling environment over that makes it even more problematic, presumably. Yeah,
I mean, I'd love to hear what David thinks about that and the impacts on vulnerable people, but I just want to chime in that I think there's also the issue of racism. And, you know, we saw right at the beginning of the pandemic how Chinese people were treated, and it was shockingly, you know, violent. And I think that, you know, when we try to enforce that type of, I guess, health approach, we are going to give rise to certain groups being targeted. And, you know, they say that sometimes the fear that arises in the pandemic is worse than the pandemic itself and can have long-lasting effects and absolutely long after lockdown.
I just add, Thalia, there that, you know, it's a classic problem in healthcare always, particularly things like antibiotic use, but also in relation to things like COVID is, of course, employment law and employment practices. I mean, if you're, a simple story I think will illustrate it, if you're a casual worker and you have a kid and you've got childcare on a Tuesday and it's the only day you've got childcare and it's the only day you can pick up that shift, are you really likely to kind of report that you might have a little sniffle, but you think it's okay, which means, of course, you're not going to get paid when you don't go to work because you're a casual worker, particularly in a setting like today, where obviously there's been significant job loss and other kind of fracturing of the workforce. And so something in a sense as seemingly unrelated as the kind of casualisation of the workforce and the way in which we manage practices around that, including, you know, saying that I'm sick and taking sick leave, or taking a day off, becomes a really fundamentally very important challenge for you know, controlling the onward transmission of something like COVID.
Thalia, I want to move just to a different area that we haven't talked about at the moment, and one that probably doesn't affect all of us, many of us directly, but I think also has implications, and it's around what's happening at the moment with judge-only trials and not having juries in criminal trials, which is something, again, that doesn't happen, as Elyse was talking about before. We've got a state-by-state difference in terms of juries being used and so forth. But what do you think about the increase of judge-only trials, and what do you see any potential for that continuing, and are there risks around that?
Yeah, we have seen this rolled out because of the issues around impaneling a jury that would sit in and deliberate in close proximity. Obviously 12 on a jury, so you would have small rooms with more than 10 people. And so I think that we, for the short term at least, will see this as a continuing practice. And I think there are grave risks attached to judge-only trials. There's very strong reasons and principles behind having a jury. It's a cornerstone of the legal system. I'd also say it's a cornerstone of our democracy, that a person has a right to have their innocence determined by their peers, and that it shouldn't be a privileged profession that determines their guilt or innocence. So it is a real threat to our principles, and this is pretty much unprecedented. And I think if it goes on any longer than necessary, it would probably be the subject of a challenge. What we see is not only is the process concerning, but the outcomes are also concerning. Studies indicate that people who are tried before a judge, where there's no election to do so, are treated in a way that's more likely to result in a determination of their guilt. So the outcomes for people in the justice system are also worse. So I think it's something to definitely keep an eye on. It's obviously only going to apply to a small number of people because a lot of trials have been delayed. But I think it's something to keep an eye on because it is part of this trend at the moment towards more executive power, more power in the hands of individuals. And I think it's something that as a society we need to resist. So it's important in terms of what it symbolises for what has occurred in lockdown, and we want to try and make that impact as narrow and short term as possible.
Can you explain to us a little bit more about what that means when you talk about a shift to executive power, and why that is something we need to be careful about?
Yeah, so we have seen that the enactment of these laws, of these health orders, but also their interpretation have been very much informed by people in the executive. So not necessarily simply those elected representatives, absolutely, as Elyse mentioned, not going through parliamentary process and parliamentary scrutiny in the same way, but also their interpretation being undertaken by people like police commissioners. So we didn't, for example, know whether we could go fishing after the March orders, and it was the police commissioner who could tell us that we could go fishing, or told us that we could have family over to look after grandparents. So things like that actually determine people's day-to-day lives were being directed by people in executive. And this is likely, I think, to have some lag effect. So they've now instituted a position of New South Wales Resilience Commissioner. And this commissioner can step in whenever the state determines there's an emergency. That might be a pandemic, but it also might be a bushfire. It might be some kind of crime that the state has determined needs a particular lockdown approach. And this commissioner will have powers to determine practices around those, or I should say regulations and practices around those types of powers. And I think that's a real risk when we try and shift that power on an ongoing basis, because what an emergency tells us is that we are no longer respecting the rule of law. This is a special case and we're going to have special powers, and those powers are going to shift from the government to some extent to unelected people in the executive.
Thanks, Thalia. That's really helpful. And I suppose, you know, the difficulty is also in the situation we're in, as I think a number of you, each of you have mentioned, is, well, how long is this going to go on for? How long are we going to be in that situation? And of course, we don't know, but and there is that risk that those powers then just continue. I want to just move to another area, Thalia, that you've been very active in, and that's around the prisoner and advocating for prisoners, particularly low-risk prisoners. So you've been advocating that they should be released during this period so that they can be safer and so forth. So what's happening there, and how is the law supporting vulnerable populations?
Yeah, and I would say probably people in places of detention are the most vulnerable. They're generally highly overcrowded places in Australia where disease can spread rapidly, much more rapidly than in the general community, but also you don't have the same access to health services in places of detention, and the people within those places tend to be much more vulnerable. High comorbidities, many Aboriginal and Torres Strait Islander people with chronic health conditions. So they're very dangerous places. And I think what I saw quite early in the pandemic was an opportunity to highlight these dangers with a view of rethinking how we understand and engage with people inside. So very much the approach to prisons has been that they're a different type of humanity that, have lesser rights because they have committed an offence and are less deserving of the same healthcare. And that's very evident in the fact that people don't get access to healthcare in the same way as they do in the community. So we have these assumptions that we've been quite comfortable with, and it's meant that the status quo has for a very long time not supported the rights of people in prison. But we saw it as an opportunity to actually shine the spotlight on health issues for people in prison, with a view to suggesting that low-risk people should be released from prison. And this is quite radical, to say that people that the courts have locked up should be released not only on a case-by-case basis, but perhaps in terms of classes of inmates. And we wrote an open letter with organisations and academics across the country in March that had a very immediate effect, and that was for the New South Wales government to, heed to our demand to release people. And so within a number of days, they introduced legislation and passed legislation that enables the Correction Commissioner to identify classes of inmates who are vulnerable and who are nearing the end of their term of imprisonment to be released by the Commissioner. So this was, I think, for us a huge win and a huge development in terms of our long-standing calls for decarceration, our long-standing belief that unwell people should not be in prisons, especially those low-risk people serving short sentences. Having said that, and after, I guess, the joy of having some kind of responsiveness by government that, for me as an academic, although I'm constantly engaged with governments and lobbying, very rarely see that level of responsiveness. So after that sense of triumph, we actually haven't seen the law applied at all. So our understanding is that the law exists to give the Corrections Commissioner powers in the event of an outbreak. It's not stated in the law, but again, returning to executive power, that's how the Commissioner has interpreted it in the event of a COVID outbreak. And that defies our message and our concerns, which is really to prevent an outbreak, to take pressure off prisons that are very overcrowded, and to, in that way, safeguard the health of both people in prison, but also the health of the community, because we know workers move between the prison and the community. We know people are released. So unfortunately, it hasn't had the desired effect.
Thanks, Thalia. Now, before we've got a few questions. Before we move to that, I'm going to just bring all the panel together again, and I guess this is a bit of a bit of an open-ended question in some way. But as we're seeing in the US, there's been quite a lot of protest against various restrictions and people, demanding that they should be allowed out and all the rest of it. But Australians on the whole have been relatively compliant with the restrictions and so forth that have been imposed. Does anyone want to take a punt at why you think that might be the case?
I can start, but I will start the discussion here. So thank you, Leslie. I think that there could potentially be, and this is a very broad generalisation, but more of an individualist ethos that also runs through probably a stronger civic education in the US. And so there's that combination, and also obviously more of an emphasis on libertarian values as well. So it is hard to generalise, and I think there are parts of the Australian community who have been voicing concerns about the potentially draconian nature of these laws, and also attempts at protest when it comes to prisoners' rights and the rights of refugees as well in detention. So I think there is still protest going on. Potentially it's aimed at more social issues often, although we did see protests against the lockdown as well. So it does seem to be that we have less of a protest culture when it comes to these laws. And I think there was a really important conversation and emphasis around helping each other and helping out our families. And we were doing this as a community together. And that's actually a positive that has arisen from this. But again, the question is, did we need some of these more draconian police powers? And I think it's okay to have a conversation about that. I think it's important to say, all right, is a fixed $1,000 fine too much when it comes to people who are homeless or poor or Indigenous, and they often already have debts that have mounted up anyway, especially in the current economic times. So I think we need to have these conversations, and they're healthy, but also keep in mind the top priority of ensuring that we, achieve those public health goals.
Thanks.
Can I just say though, I don't know the extent to which this was occurring, but it absolutely was the case that people were starting to stay home, starting to pull their kids out of school, starting to work at home. Businesses were starting to limit their trade even before the laws came into effect. So I think there was a general concern led by very good evidence and looking at what was happening around the world among Australian people that didn't always necessitate laws. In fact, I think sometimes the laws followed people's behaviours and followed their concerns. So there's more of a complex interrelationship that maybe means the government is not the only source of credit for our low rates.
I think that's really interesting, and the point that Elyse makes as well around that willingness of people to be supportive. You know, we did see that, and we saw a lot of local community activities where people tried to help out, you know, say elderly people in a community and so forth. And that is, you know, I wonder how we take that further forward in the sense of the discussion that we need to have, as Elyse was saying, so that rather than just going for the, you know, the sort of emergency or the police powers, but is there a way, do you think, as a community that we can take that forward or keep that discussion going?
Well, I mean, I would say healthcare and disease is often very scary, but it also can kind of render visible some of the very basic fault lines as well as strengths of individuals and communities and even states and nations. And I think one of the things that COVID has in part done is to render visible some of those things. Essentially, as Thalia and Elyse are both saying, people were acting and responding for the common good before formal legislative measures and directions were made. Those directions may or may not have been necessary. They may or may not have been well drafted. You know, they certainly did cause a bit of a panic. I mean, what is exercise in the park? You know, how fast you have to walk for it to be exercise. We kind of gave everyone a first year law statutory interpretation problem all at once. But I think the fact that people were already responding was really interesting. And actually, of course, there may be outliers always, but if the vast bulk of people not only have a self-interest in protecting themselves and the people they love, but also their communities and in a sense their nation, then, you know, there is a real opportunity to say, well, how do we actually give information, evidence, support, and where needed for some people, particularly strong supports, to help them to do what they already want to do. And I think that's something we need to think more about in relation not just to public health and healthcare, because of course people have a strong personal vested interest in that, but also things that we've been talking about, from criminal legal responses to anything from, juvenile justice and juvenile crimes through to drug sentencing and all types of things, right the way through to employment law. Most people want to do the right thing, but how do we actually empower them to do that rather than necessarily using the hammer all the time?
Now, you've given me a great segue, David, because I'm going to go to the questions that our audience, whom we can't see, but are certainly out there. And so one of the questions is a little bit around employment law. And I'll open this up to any of you who want to immediately qualify as an employment lawyer. What is the thinking behind making it an offence for an employer to require an employee to download the COVID app?
I might start because it sort of crosses over between employment law and public health practice and law. And I'm, full disclosure, not an employment lawyer, but I suppose on the one hand, my first response is that kind of lawmaking shows, in a sense, what at least the lawmakers believe is at stake, right? In having people adopt the COVID Safe app and to continue to behave in ways that are supportive of reducing onward disease transmission. Now, whether or not you think the COVID Safe app is or is not a kind of a good quality tool for that, it does show that lawmakers are quite concerned in order to do that. But I suppose it also, on the other hand, underlines something that Elyse was saying a little bit, I think, too, which is that the Australian legal system and our political system, for good or ill, and we won't, I think, get into this debate right now, but essentially relies on people being upright and careful about how they exercise power, both in the workplace, the judicial system, as politicians, as members of the executive. Now, there are lots of criticisms to be made that I think are very valid about reliance on that, rather than the alternative of a kind of well-enumerated set of rights or well-enumerated set of responsibilities or whatever system you have. But it becomes very clear that actually it's a real threat that employers might say you must have this app downloaded, and so clearly government responds. And so here I think we kind of, again, render visible some of these fault lines around where we're relying on people kind of being good blokes and not doing this stuff, when in fact the actual, if they did have people to kind of force people to download it, could have a hugely detrimental effect on the uptake and support of the app, and thus on disease transmission.
Thanks. Another question from our audience, and I might shoot this to Elyse because I think this is work that you've done some research on. What can people do if they feel that they've been unfairly fined during this time?
Yeah, so a lot of my research has been on the issuing of penalty notices for offences like offensive behaviour and offensive language like swearing. And we can see this form of penalty notice has been transplanted to the COVID-19 context, but with really expensive fines for some of them. So $1,000, for example, for the breach of the public health orders on gathering and movement, or $5,000, a fixed $5,000 fine for breach of that order that we talked about before in relation to spitting or coughing on a public official or worker. So we can see there's some really expensive fixed fines. Now, there is an opportunity that people have to seek an internal review of that fine. And even though I recall the police commissioner said that he would personally review a bunch of these, or all of these fines, he said, there's still that right to seek an internal review, and that depends on your review body in your state or territory. So for example, in New South Wales, it's Revenue New South Wales. And it's important, if you are seeking that review, that you accompany that with reasons for why you should not have been issued that fine. It might be because you had a reasonable excuse at the time, and so and there could be a bunch of reasons there. It could be because, for example, if you were homeless and you were not able to be inside at the time or isolate. So what is important though is that you do seek legal advice in relation to this. So I do recommend people seek legal advice, for example, from their local community legal centre. And there's also a right to appeal a fine, but I think it's important to exercise that initial internal review right first in most instances. But if you do seek to appeal that fine, you do risk a criminal conviction. So that would be something you should definitely get legal advice on.
Thanks, Elyse. And another question, and I'll just throw this open to the panel. What laws in general are there to prevent people taking advantage of this situation, hoarding products and reselling, for example? Anyone want to have a go?
Thalia, I'll go on. Thalia, you go first.
Look, I was just going to say the federal government and New South Wales government came out very clearly saying, they're going to come down on people who are stockpiling. But really the response then shifted to management by whether it was pharmacists, because obviously stockpiling of medicine is of critical concern. So they had limits on how much Ventolin, for example, you could purchase. And then there was a shift towards regulating supermarkets, so you could only purchase so many, packets of pasta or rolls of toilet paper. So it has been, the response over time became a regulatory one after the very strong punitive messages sent by government. And I think it's worked well, except for some of the earlier stockpiling and the ongoing investigations into those cases, which from my understanding have in the main been dealt with through civil processes, but David might have something to add to that.
Look, I would just add that one of the things that's been obvious is how much we rely on a range of professions as well as people in different employment categories to make society work. You know, I think a lot of people have made comment about the fact that, you know, access to really important fundamental things relies on people who move stuff from one place to the other and sell it in a supermarket, and everyone that's involved in that chain. But from a health and kind of regulatory perspective too, I think we are very lucky in this country to have a very well-developed set of professions, pharmacists and others, for example, that we actually rely on all the time to kind of do the right thing and to do the kind of right clinical thing without having necessarily to kind of make kind of intense laws to control their behaviour. And that's something I think hopefully at the end of this, after lockdown, we kind of come to think of as a great advantage and the one we do rely on and we should.
And it became a much more complex situation. I mean, we did see some of that behaviour at the beginning, perhaps, and perhaps some of that stockpiling for profit. But actually what we did discover as well is that as a community and the way that our food supplies and so forth operate, it's very much a just-in-time process now. And that something might be packaged, produced, you know, tomatoes or something and tomato sauce in this country, but we rely on another country to produce the jar or the lid or something like that. And so, you know, the pandemic in that sense has opened up some of that complexity that you were talking about, David, and how we do have to manage these situations. I think we're going to have to stop. Unfortunately, there are a couple more questions, but I hope that has given you an insight into what's been happening to our laws, some of the ramifications for that during this period, and really how complex it is and how important it will be to watch how we move out of the virus and what some of those long-term implications will be. But I want to thank particularly Elyse, Thalia and David, my wonderful colleagues, and for their really informed advice and discussion. And I know that throughout this period, each of them have been making contributions into the public sphere around some of what's happening to law in the context of the virus. And if I can just remind you before we finally close that you can visit uts.edu.au/events for further events in this series. And certainly if you've got the time, I'm not sure who does at the moment, but anyway, if you've got some spare time and you'd like to try one of the UTS tasted courses, you can visit those on open.uts.edu.au for free online courses. This webinar is going to be posted on YouTube soon, and we very much hope that you'll be back for our next event. So thank you very much. Sorry we can't see you in person, but we hope you've enjoyed the session. Thank you.